Here, the next is Dr. Shruthi MK. The next speaker, Dr. Manisha Supriya, is here. Okay. Mr. Nikhil Kumar. Okay, Manisha is there. So you're the next speaker, so you will be here, just to let you know.
Please start. Okay. Good morning, all. So I'll be presenting our study wherein we have evaluated orbital and ocular metastasis as the initial presentation of occult primary malignancies. So as we all know, orbital and intraocular metastasis is rare, and they present with a varied symptoms, ranging from diplopia to proptosis to diminished vision. In a large case series by Shields et al., she has seen that 19% of cases there is no history of underlying carcinoma. So that was a research question. We have, in our study, outlined the spectrum of pathological changes and the clinical manifestations, imaging, and management outcomes. So this was carried out in a tertiary eye hospital with a dedicated ocular oncology service with an availability of ophthalmic pathologists, and we have 7 cases to show you. So all the samples were analyzed by a trained ophthalmic pathologist, HPV was done, customized IHC panel was done, and a recent AGCC guidelines was used for the tumor staging, and follow-up has been highlighted. So the first case was a 55-year-old lady. She came with for the management of corneal melt. A working diagnosis was idiopathic orbital inflammatory disease with exposure keratitis. And on histopathology, what we saw was large atypical cells, plasmacytoid appearance, signet cells, and most importantly, Indian file pattern. This hinted towards a metastatic disease. So we called her back, took a detailed history. We saw that she had a lump in the breast with classical malignant changes. She admitted to having noticed it a year back, but had not got it tested because of social stigma. So we went back, did the breast markers on the orbital biopsy block, confirmed it to be a mets from the breast, and referred her to the oncology center. The breast FNAC and biopsy confirmed lobular carcinoma. PET scan was done, which showed an unfortunately a stage 4 disease, and this patient succumbed within 3 months of diagnosis. Other case was a healthy male, 31-year-old male with protrusion of right eye, no other complaints. A working diagnosis was left right lacrimal gland tumor. And then on biopsy, we found this atypical adenomatoid pattern of cells with RBC. So whenever tumor cells comes with a lot of RBCs, could be hematogenous metastasis. So we ran a customized panel, and we saw that this was a case of lung carcinoma. So the PET again confirmed the same, and he is on targeted therapy with EGFR inhibitors. This is another case who was referred to us with choroidal melanoma, but her optos and B-scan features were more in favor of choroidal mets over choroidal melanoma in even the A-scan. That was confirmed by our retina folks, and we did a PET scan, and we saw a 2-centimeter nodule in the lung. It was a non-small cell carcinoma of the lung. This is a 3-year-old small child, came with left eye proptosis and swelling. Histopathology showed small blue round cell tumor. But then when we ran the IHC panel, it pointed towards a neuroendocrine tumor. We did the PET, and this turned out to be a metastatic neuroblastoma of the adrenal gland. Now, the following next 3 cases are hematological malignancies. So in all these cases, which presented with ocular manifestation, and in all these cases, apart from biopsy, a simple peripheral smear helped us to clinch the diagnosis. So this is a case of a 4-year-old male with upper lid fullness and hypoglobus. Peripheral smear revealed the diagnosis of acute leukemia, and cytogenetics confirmed it. This person came with a periorbital swelling, FNAC of the same end, peripheral smear showed a lot of plasma cells, and the workup was positive for multiple myeloma. This case was interesting again. She was a 14-year-old female, presented with us like an acute acrocystitis kind of a picture. She was a known case of aplastic anemia. When we did a peripheral smear, it had transformed to acute leukemia. So this was chloroma, which was presenting in the lacrimal gland, sac, sorry. So what a study adds is orbital metastasis in an unknown solid organ malignancy occurs at later stage, but also can occur at an early stage. Surgical debulking is effective in decreasing the mass effect. Orbital radiotherapy and targeted therapy offers promising results. So as we all know, eyes are windows to your health, not just systemic disease, but even cancers from other organ system can present with orbital manifestation as the first presenting system. A keen history, a good pathology workup, and a multidisciplinary approach is the mainstay of treatment. And a timely biopsy with IHC panel, a customized IHC panel, systemic workup, a peripheral smear, and PET is mandatory in all these suspected cases. Thank you.
Thank you, Dr. Shruthi. This is very interesting. And one other diagnosis which I have come across apart from some of the, the hematological malignancies and multiple myeloma is lymphoma. So did you come across any case of lymphoma which presented as proptosis?
So, ma'am, a lot of primary orbital ocular lymphomas do present with proptosis mainly, but systemic lymphomas initially presenting only when they're in a very advanced stage. So they do present with.
Yeah, sometimes they can be in the liver and present with a.
Yeah. So I think in terms of ease of classification, clumping hematological malignancies along with solid organ primaries with orbital or ocular mets may not be apples and apples because hematological malignancies, once they start in the marrow and in the bloodstream, they are free to disseminate anywhere. And the presence of an extramedullary site really doesn't change the prognosis as compared to that of a solid organ like a lung or a liver or a breast, where the presence of a metastasis automatically takes you to the M0 in the AJCC. So maybe better to keep the leukemias, myelomas out of orbital mets lesions.
Totally agreed, sir. So our studies just to show that orbital mets do present as a primary in the eye, even when there is a hidden malignancy inside, undiagnosed cases.
Thank you.